Good morning, Dr. Kunal. Last time we met, you were telling me about a case of bipolar disorder that you saw, and you told me how common it is. You also mentioned that the awareness about this illness is bare minimum. Now that we have the opportunity, let's talk about bipolar disorder today.
Sure, thanks for that opportunity. Bipolar disorder is an illness that has an impact on an individual's mood. All of us um, have a slightly different prevailing mood. So, you may have observed from your experience that some people are generally happier than others, and some people are generally a bit reserved, and some people are generally a bit short tempered. So, emotions are normal, aren't they? Happiness, anger, sadness, anxiety, or fearfulness. Having said that, whenever there is a significant shift in an individual's mood, so somebody who's usually reserved suddenly becomes a lot more happy, confident, outgoing, sometimes even aggressive, that might be because of bipolar disorder.
So, doctor, can you please elaborate on this issue so that our viewers are able to understand it in a better way?
So, as the name suggests, bipolar disorder can happen in two different phases, and it's largely an episodic illness, which means that when people are unwell, they experience symptoms, but then when they become well, they go back to being more or less completely normal. There are two different types of episodes that they can experience. The first one, in which the mood is persistently elevated, is known as hypomania or mania. In this, characteristically what happens is that an individual experiences an increase in the amount of their energy levels, their confidence, their concentration, sometimes even their ability to do more things. They might start new ventures, or they might be slightly reckless and aggressive at times. So, this is what happens when your mood becomes slightly increased. The opposite of this is known as depression, in which people feel sad and have poor energy levels, have poor concentration, don't feel like doing anything, and this is known as depression. So, basically in bipolar disorder, individuals can either experience hypomania or mania, or depression, both of which are treatable conditions, and when people are treated, they go back to being completely well.